Going to discuss some of the congenital anemias now. The first one is a pure red cell anemia, also known as black fan diamond syndrome. These patients will, at birth, may have low hemoglobins already. Babies, like I said earlier, will have relative hypoxia in utero. These babies, when they're born, will have high hemoglobin simply because of erythropoietin stimulation. And it's not unusual to see hemoglobins of 18, 19, 20, 21 in a newborn. Patients with black fan diamond syndrome may be born and have a hemoglobin of 10 or 11. That's already suspiciously low at birth. Black fan diamond is also associated with some other findings, such as short stature. So there's another pathologic cause of short stature. They can have some craniofacial deformities and look for defects of the upper extremities. The triphalangeal thumb is basically a thumb that has several joints in it. It has an extra joint, almost like a regular finger. You will see in this case macrocytosis as opposed to microcytosis. Hemoglobin F in the newborn will be increased, and they will have an increased adenosine deaminase, that's ADA. The reticulocyte count will be low. The reason for that is it's really a bone marrow failure. They're not producing the red blood cells in the bone marrow, so the retic count will also be low. Remember, reticulocytes are young forms. The treatment is going to be corticosteroids. They require recurrent transfusions to keep their hemoglobin up. When you give recurrent transfusions, one of the problems that you run into is iron overload, and so these patients may require deferoxamine because of the iron overload. Basically they'll need stem cell transplantation or else they'll have a shortened lifespan. Congenital pancytopenia or Fanconi's anemia. If it's a pancytopenia, that means that all of the marrow precursors are decreased. So that means it'll be white cells, the red cells, and the platelets. This goes along with other findings such as short stature and absent or hypoplastic thumbs. So with the black fan diamond, they have just pure red blood cell anemia. They will have a triphalangeal thumb and short stature. With the Fanconi's, they also have short stature, but they'll have an absent or hypoplastic thumb, so slightly different skeletal abnormalities. They can have other organ defects, and these patients will many times have café au lait spots. They also have macrocytosis on the peripheral smear, and the bone marrow shows complete hypoplasia of all three cell lines. And that's how you're going to make that diagnosis. First of all, you're going to do a bone marrow aspiration, and then you can send off cytogenetic studies. Complications of Fanconi's include leukemia. So remember that as a complication, particularly acute myelogenous leukemia, or AML. Treatment is also with corticosteroids and androgenic hormones. You need to treat infections aggressively because they are at risk for infection since they have basically no white cells, and they will need bone marrow transplantation.